Good morning. My name is Sinead Dufour from McMaster University in Canada, and I'm really thrilled to be here today to speak to you about just our Phase 1 results from a consensus study led by myself and Stephanie Bernard on the topic of pregnancy-related diastasis rectus abdominis. So I have no disclosures, but did want to acknowledge a grant from the McPherson Institute at McMaster that funded this work, as well as an ICS Travel Award. So why did we seek to do this study in the first place? Well, the landscape for diastasis rectus abdominis really can be quite confusing for practitioners in terms of guiding their practice, but as well as women seeking care. So we have limitations in our current literature base, and recently there has been some suggestion that the concept of a widened linea alba may lack the clinical relevance related to this condition, and is that really the parameter that we should be looking at with this tissue? The other piece relates to the advocacy for research approaches that engage knowledge users and principles of practice-based research, and we also wanted to incorporate that. So the primary objective of this work through the full consensus process was to establish a set of practice principles to support a more cohesive, evidence and practice-informed approach to diastasis rectus abdominis, ideally to be used across disciplines. For Phase 1, which I'll be speaking about today, the aim was to develop a preliminary set of consensus statements regarding conservative management of diastasis rectus abdominis that would then be evolved and teased out into the principles in Phases 2 and 3. So this slide just outlines the methods of our Delphi consensus, starting with our literature review, securing our panel of experts, and then moving on to the 3 phases of the Delphi consensus to our findings, and then putting that into practice and guidance for further research. So this work, as I indicated, was informed by principles of practice-based inquiry, as well as the knowledge to action KT framework. In the Phase 1, we developed the survey through systematic review of the literature, but also engaging with stakeholders. And we invited participants who we determined as experts across Canada, either through their clinical credentials or accomplishments or through their academic credentials or accomplishments. And all our participants completed an online survey as Phase 1. So this survey had 82 statements organized in prevention, management, and assessment, and organized through the different stages of perinatal care. So prenatal, early postnatal, postpartum. The participants were asked to agree with a statement on a 5-point scale. Agreement was considered to be achieved with a score of 4 or 5, and we did a simple proportion analysis to determine consensus with at least 75% agreement. And also in this first phase, there was lots of opportunity for feedback and free-form text, so we could make sure that we were capturing any concepts that we had missed from our literature review. So our participation rate was 75%, so 21 of the 28 experts across the country participated, and they represented 6 different provinces in Canada. Of the 82 consensus statements, 38 actually generated consensus of the 82 initial statements, and 24 with a very high degree of consensus. 4 statements that achieved consensus actually was consensus to disagree with a statement that captures some current perspectives in diastasis, so I will make sure I highlight those. And then the remaining went on to Phases 2 and 3 to be ranked and explored further. So these are the 4 statements that actually there was consensus for disagreement. So for the first one being that diastasis doesn't appear to be related to the pelvic floor. So actually we see that our participants really do see this as a condition related to the pelvic floor. The second point highlights that the severity of the diastasis does impact our experts' approach to the problem. The third point highlights the fact that our experts actually don't think that emphasizing closing of the gap through the Noble technique is really an appropriate approach. And then the last point speaks to the fact that our experts really acknowledge we are talking about a functional issue, not just a cosmetic issue. So I'm just going to highlight the point with the highest amount of agreement for each of the sections. So for the prenatal period, emphasizing postures that reduce excessive sustained intra-abdominal pressure had over 90% agreement. So we can see here that our experts really do consider the problem of diastasis rectus abdominis as intrinsic with the deep core system and the manometric pressure system. We see that through all of the categories. So for the early postpartum period, the highest degree of agreement was avoiding exercises in which the continence mechanism is not maintained. So again, highlighting the connection between diastasis and the whole inner unit. For the postpartum period, avoiding exercises that cause doming or invagination of the linea alba. So again, looking more at properties of the linea alba that go beyond just looking at the width or the interrecti distance was determined to be really important. And then as far as assessment was concerned, this is actually where there was very little agreement. And the highest agreement was to actually assess the development of tension through the linea alba through a voluntary pelvic floor transverse abdominis contraction. So as far as we know, this is the first study to engage knowledge users in attempts to try to bridge the current practice gap that exists with diastasis. We did have 20 statements that achieved high rate of agreement, but we initially started with 82. So there still is clearly a lot of disagreement within this landscape. Certainly there was a lot of agreement that the linea alba is intrinsic to the thoracopelvic abdominal manometric system, and that we really need to consider that context. And so certainly the results from this study will hopefully bridge the practice knowledge gap by engaging knowledge users in this process and really thinking about the concept of closing the gap, and that might be not congruent with a clinically relevant or comprehensive approach. These are my acknowledgements, and I'd be happy to take any questions.
Questions, please.
Sukra from Australia. Because you highlighted certain sections, I didn't get to read the whole slide. I'm just wondering if there was any comment about the fact that when you have a significant diastasis, there's actually a lot of pressure lost through that rather than down through the pelvic floor, and that in fact sometimes you can see in patients that there is that protection sort of to the pelvic floor because of the fact the pressure is lost through the front gap.
Yeah, so a lot of the comments that came through actually with this work were around ideas like that and how just treatment has to be so individually tailored. So our experts often had a hard time agreeing or disagreeing with some of the statements because they would give examples like that or tension or different things going on that had to be individually tailored. However, the concept of really not just thinking of this as an issue of just kind of a widened linea alba and thinking about the whole system, as you suggested, came through in every single phase.
So I suppose within there is a statement that continuing to individually assess patients rather than having a recipe for following certain things is obviously in there that are... Yeah.
Exactly.
Thank you for a very interesting study. I think it's very important that we know what the practitioners are doing for the moment, because this area is really, there's so little evidence for what we should do. But there is one other study from the US, Keeler, that also looked into what physiotherapists were doing, and it was a wide range of different approaches. But again, my main point is that it's fine to know what the physiotherapists think and what they do, but they are thinking this without any evidence. So we need to do knowledge-based approach to this and really find out, is there any link between low back pain and the diastasis? We have 2 studies now showing there is no link in moderate, and what happens when you are doing peripheral muscle contractions. We will have a presentation later today on that. So I think this is a new and very important area. It's so many women who have problems with this, and we have so little to tell them, and we don't know how to base our recommendations for the moment. So thank you.
Yeah, no, I would agree. And I would also say that an interesting piece that came out of this work was around the assessment piece. And the few good studies that we do have on this topic have already assessed and defined this issue by interrecti distance, rather than assessing kind of more the whole system or other parameters of the linea alba. So again, maybe this can inform future research from that perspective.
Of course, we might have time. Can I just also ask about the fact that this core statement was that this is not a cosmetic issue but a functional issue? But what I find with my patients who have a significant diastasis and are often quite slim and are asked all the time, are they having another baby, that the psychosocial component of that, what we call cosmetic, that can't be underestimated because it has a severe impact. I've got many patients who are quite depressed about their look, and that's not in a vain way, that's just they're constantly reminded every day by questions from, kindy mums and things. So I don't think we should underestimate the importance of that cosmetic value for women themselves.
Yep, no, and I would agree with you. I think that the aesthetic component does impact global health. But I think, too, sometimes as physiotherapists, through our assessments, we can get a sense that there is something more functionally related with what's happening with this tissue. And often other healthcare providers have indicated to these clients that, oh no, that's not affecting your function at all, it's just cosmetic. So that I think highlights that perspective too.
I have a question, if I may. I was just wondering about your choice of methodology. You decided to ask the physiotherapists what they thought about what we should do as evaluation of treatment. What didn't you do literature review?
So we did that first, and because through doing the literature review, there was still very little direction in terms of what should we be doing. For those of us who teach in the physiotherapy curriculum, that's always been an issue. How do we even teach what to do with this condition? Because the evidence isn't guiding us. So we thought a consensus to at least try to establish some common ground to hopefully inform future research might be an important next step.
I would recommend that maybe you try to publish that as a systematic review, because I think that from what you have done, this is very interesting, but we are losing that information that you found in the literature, and it would be interesting.
Okay, thank you.
I have also a last question, and that is about patient engagement in this kind of processes. Do you have any plans?
To engage patients in the process? Actually, as we were going through the research, that was one of the things we thought, this would have probably been better had we have got those end users involved in the process. So certainly that would be an important next step.
Okay.
Thank you.
Thank you.